Good record keeping is integral to nursing practice and is essential for safe, effective patient care. Traditionally, patient documentation was on paper, however, transitioned to EMR systems. Clinicians found that information was more legible than in paper records. Multidisciplinary teams were able to share individual patient clinical care details across sites and between departments, and there was greater efficiency when patients were transferred between services. There are many variations, and nursing students are likely to encounter them after graduation. Nursing school programs tasked with the incumbent responsibility of didactic knowledge transfer, many universities were revamping their curriculum. As you know, curriculum lays the groundwork for nursing education and is noted in the Institute of Medicine report, IOM section of the Future of Nursing. There is an expectation that nursing curricula adapt to changes in society and technology. Clinical experience shortages. When we talk about clinical experience shortages, we worry that clinical placement was a challenge. However, the pandemic made that problem intensify. Hospitals limiting the amount of students allowed or pausing it temporarily, or in some cases permanently. Faculty relied on their simulation labs to fill in for the lack of clinical sites available to fulfill the hours for the students. And on top of everything else, you now add the implementation of the electronic medical record. Academia is just scrambling to keep up, and with all these changes mentioned, it seems like it was colliding all at once. As we talk about curriculum revision, in the past 5 years, academia has revised the curriculum to include technology on all levels to prepare early career nursing students. While hospitals and other healthcare organizations are focused on training the current workforce to use informatics systems like the EMR, universities providing nursing and allied health education programs are in a less favorable position given the limited access to software and computer systems for hand-on informatics training. As a result, future healthcare professionals often graduate with little knowledge regarding informatics. The important task of orientating newly hired nurses to an organization's information system and workflows have grown more challenging, especially in the increasing presence of the electronic medical record technologies. New nurse hires EMR training has an important function of incorporating workflows and policies in in addition to introducing system functionality. Hospital systems expect new hires to be confident nurses who are equipped with the knowledge they need to be successful with patient care. Hospital expectations also are that nursing students are competent early career nurses, that they understand that they will need a preceptor to guide them through the workflow of patient care. However, when the hospital hires, especially new graduates, the onboarding for the EMR could vary from as little as 1 hour to 1 day. The thinking is the students learn this skill in nursing school and just apply that knowledge to their hospital's EMR system. So the expectation of the new nurse is to be experienced in the electronic documentation is real. The hope is that many nurses have had some experience with the EMR during nursing school, so the orientation is more about using the system to integrate specific hospital system workflow than to teach them how then the EMR functions. Each hospital encounter is recorded by clinical documentation for billing and data collection, so accurate accounting is essential. The EMR has assisted with standardizing the information collected for easy retrieval. Institutions rely heavily on the EMR documentation to fulfill regulatory requirements that often coincide with reimbursement for patient care. There is wide variation in the EMR training environment for student nurses. Very little have had some practice. Others have seen or heard of it in simulation labs with no practice, while others are able to view the instructor document. However, they are not getting adequate experience to be competent. Just because it is listed in the school's content does not measure the degree of the exposure. Their experiences could eventually influence their attitudes to EMRs, negative or positive, and these attitudes will persist as they enter practice. As informatic nurses and health system trainers, our interactions and observations with the new hires often reveal various insights from the encounters. New nurses feel ill-prepared to document while delivering patient care due to the lack of exposure during their generic nursing school. Adapting to the new technology, improving outcomes, and promoting patient safety require education strategies focused on increasing nursing and health professional student informatics competency and cultivating healthcare teams' performance. As they are joining the multidisciplinary team, the new nurses are lacking the confidence in documentation. This notion spurred a research idea to explore and discuss the challenges observed by early career nurses and their perception of their EMR training and exposure in nursing school. So my colleague and I, as we were doing the training, we would actually overhear some of the new nurses' discussions, and we would engage in that discussion. All of this now prompted the purpose of this presentation. Pretty much early career nurses and their challenges, and also the EMR training's perception and exposure. These are our research questions. So, which prompted the purpose of this presentation is by these two questions. How is the EMR documentation covered in academia? And two, is there a gap in EMR documentation and the hands-on practice within the curriculum while they are learning patient care? So we're not saying that the EMR is not covered in academia. We're not saying the students are saying that, but is there a gap in what they perceive as getting the proper education and feeling confident after they graduate? So I would like to describe our methodology. So you see in the first box, State Nurses Association. So we approached our local state nursing association and asked, would we be allowed access to their members to complete or to get a focus group and ask a couple of questions to see if there is even a need for a particular survey. So we were granted permission from that state nursing, student nursing association to use a focus group of nursing students to corroborate the hunch with a voluntary sample to confirm if a problem exists.